Good morning. This is Dr. Timothy Scott Beck here at Life Point Medical, and I want to say hey to you. It is March the 17th of 2025, and we're up and running this morning, doing pretty good. And I'm just going to run a few things by you. First of all, I want to let you know and remind you that part of my goal in life when I open this office and when I'm taking care of people is to keep you out of trouble, keep you out of the hospital, and intervene as soon as possible if something's going on with you so I can keep you from going to the hospital or feeling the full brunt of a disease. So with that, you got to help me out here and call me if you need me, okay? And we'll get you in here and get you seen as quickly as possible to try to keep you safe and out of trouble. So one of the things that I see quite often here, and I want to talk to you about that, and it's a management issue basically with people, and it's they're running out of their medicines, okay? And almost maybe once a week, I will see a patient, and sometimes it's not an established patient, sometimes it's a new patient, but they've been out of their medication for a week or a month, and I'm like, that's really not a good idea. So I really I talk about taking your medicines consistently around here all the time because I think that's real important. But also, not running out of medicine is really important, okay? And because presumably you're on these medicines for a reason, and if you're not on that medicine, it may be hurting you terribly. So that's another reason that I have same day appointments, and why we have so many ways for you to communicate with us is because if we see or think you're running out of your medicine, we're going to help you with that and we're going to take care of that for you. If you are running out of your medicine, I kindly ask that you call us here at the office or communicate with us here at the office and let us manage that before you even go to the pharmacist. Because sometimes people call the pharmacy and ask for their medication refills. And to me, that just adds about 3 or 4 more steps to the whole process and is unnecessary. If you call us first, we will be able to process it twice as fast and get you what you need when it comes to your medications, if it's appropriate. I refill most people's medicines. Sometimes I refill medicines for people that other doctors prescribe just so they don't run out. Now, that's not pain medicine or anything like that, but if I've got somebody who's visiting from out of town and they're running out of their medicine or whatever the issue is, and they're having a problem, I'll see them and I'll get them taken care of so that they don't have to suffer any harm from not having their medication. So just another little hint there. Don't run out of your meds. Let me help you with that and keep you into them. Plus, when we refill meds, we usually refill for an entire year. That's just the way I do things. And then the second thing I want to talk to, just is just another medical issue. And let's talk about alcohol. I've got a lot of experience with alcohol, good, bad, or indifferent. I'm not a completely teetotaler in the fact that I don't drink any alcohol. I drink alcohol quite often, but I hardly ever drink much. Matter of fact, if I drink 2 or 3 drinks, I'm usually asleep, which is a good thing. I'm okay with that because I don't need to drink no more than that. And that's really what I want to talk to you about. The high limit of alcohol that you should consume during the day is really 2 drinks. That's either 2 shots of liquor, 2 beers, or 2 glasses of wine, and that's if you don't have alcohol problems. If you've got alcohol problems, stay away from it. And I will be honest with you. I have took care of lots and lots and lots and lots of people who have suffered mainly or primarily from alcohol use. Matter of fact, I think alcohol might be the most destructive drug that I've dealt with throughout my career. Now, it's legal, okay, so, or at least for the most part here in Raven County. So, it's not that these people are doing anything illegal or anything like that. It's just, I just don't think alcohol is that good for you. And there's more and more evidence coming out that it does little for you. It does little for me as far as the effects that I get from it. Like usually I just go to sleep, but it's not a good sleep, and I usually wake up a couple hours later not sleepy, which is worse. So the best thing to do is avoid alcohol or limit your alcohol severely to 2 drinks per day. And certainly, if you're drinking more of that or you're getting into trouble with it and you need help with it, that might be something we need to talk about. And a lot of times people come to me and they say very honestly, I've got a trouble with my alcohol use and I need help. And they realize that they can't do it themselves, which is perfect. And we try to help them get into a good place. Sometimes we're successful, sometimes we're not. Okay, but to wrap that up, alcohol in limited doses is okay. Limit your consumption throughout your lifetime. I definitely recommend, and certainly don't let it control, destroy, or ruin your life. Okay, all right, that's the alcohol. So if you need to get a hold of us, 706-782-0016. You can call us. We'll try to answer the phone. We try to answer within 3 rings, but sometimes we don't. You can leave a message. I still get daily people saying, I've called your office 6 times and nobody will answer the phone. I said, did you leave a message? And said, no. Well, we actually have a messaging system that has to be checked periodically. So do that for us. You can text us at 706-607-1168. You can email us at office@drtspec.com, or you can go to the website at drtspec.com. And there's a chat bot there where you can ask them a question. Hey, I need a visit. I need help with something, whatever, and they will respond to you in the appropriate manner. All right, this is Dr. Timothy Scott Beck, LifePoint Medical. Thank you for listening to me. Have a great day, and I'll talk to you next week.